Hi, I'm Dr. Theo from Chiropractic, and today we're going to be talking about chiropractic and how chiropractic can help you with pregnancy. For me as a chiropractor, I would say and recommend that everybody should be under chiropractic care, especially when considering pregnancy, because it's a time of great change for your body. You're going to have hormonal changes, you're going to have biomechanical changes, your weight's going to change, and in order to adapt to all that change, we need our nervous system functioning at its peak capacity. Because as we know, the brain controls the entire body, and we're not just talking about the muscles and the bones, we're actually talking about all the organs. And you can see on this picture here that there are very good and clear connections between the brain and the organs. This is how our body is controlled and coordinated all the time. Now, if this connection between the brain and the body has any distortion in it, that's going to affect your posture. And one of the big things about posture is if you have a worse posture, obviously when you start having all these biomechanical changes, this is going to affect you in a worse way. Another thing about posture is this going to affect your sleep. And sleep is a very important thing, especially in that later trimesters when things start to get uncomfortable and you start to have maybe even more complaints. One of the things that we talk about when we talk about complaints is chiropractic can help with those too. I mean, we help people every day with sciaticas, with back pain, with headaches, with these normal types of things that everybody seems to consider normal. But especially when you're pregnant and your body's going through these hormonal changes and physical changes, a lot more of these complaints can be magnified and can be more uncomfortable, and you don't want to be uncomfortable when you're pregnant. One of the things that we also look at with pregnancy is that the natural childbirth is pretty high on the list for most people, and if the baby doesn't turn, then that's going to prevent you from most likely having a natural childbirth. Now, one of the main reasons that the baby doesn't turn is because the uterus can have what we call constraint. There can be some torsion caused by a misaligned pelvis that's going to interfere with the amount of space that the baby has to move around freely in the uterus. And if this torsion in the pelvis causes torsion in the uterus, it's going to block the area for the baby to turn. And through very gentle, very specific chiropractic adjustments, we can help that baby turn without ever laying a single finger on the baby, which is amazing. It usually doesn't take a very long time and works really well if the person's been under chiropractic care before, but it's not absolutely necessary. We've had a lot of women come in that found out that they couldn't have a natural childbirth, found out the baby was in a breech position, and within a couple of adjustments, the baby turned and they were able to actually realize their dreams of having a natural childbirth, which I think is pretty cool. Another one of the things that we have to consider with pregnancy is not just during the pregnancy, but after the pregnancy. Many of the physical complaints that you had during pregnancy can continue on into the after pregnancy time, the postnatal period. And if you get chiropractic care, it can help you with those complaints. But one of the advantages that we have in that postnatal period is that the body secretes a hormone called relaxin. And relaxin helps all your ligaments open up, and that allows us to move the joints a lot easier and a lot better. So when you're thinking about pregnancy, instead of just thinking about all of the stuff we're going to buy for the baby, all the way we're going to set up the room, all the things we're going to do after the pregnancy happens, let's think about taking care of mom. Let's think about giving that baby the best possible vehicle it can ride in for those 9 months. And then once that happens, we'll get the mom straightened out, help her with any postpartum depression, help her sleep. And then a little bit later, maybe in another video, we can talk about how we can help the baby as well. Because one of the first problems that we notice is due to the birth, the baby can actually get what we call a subluxation or a small lesion in the spine that can have pretty grave consequences future, but we'll talk about that in another video. So one more time, I'm Dr. Theo from Chiropractic. Thanks.